Welcome to today's lecture on thyroid examination. In this video, we will explore the clinical importance of the thyroid gland and its role in regulating metabolism, growth, and development. We will cover topics such as visible changes, palpation, imaging modalities, and laboratory investigations. By the end, you will have a comprehensive understanding of thyroid examination. Let's begin our exploration. In this section, we will explore the clinical significance of thyroid examination and its role in identifying thyroid disorders. Understanding the thyroid gland's function and importance in regulating bodily functions is essential for effective diagnosis and treatment. When examining the thyroid, one must first inspect the neck for any visible changes like swelling, goiter, asymmetry, or abnormal movements during swallowing. Additionally, the skin over the gland and surrounding structures should be assessed for signs of inflammation, discoloration, or abnormal vascular patterns. These external changes can provide significant diagnostic information for further investigations. Palpation is a crucial component of thyroid examination, where clinicians physically assess the size, shape, and consistency of the thyroid gland. By gently placing their fingers on the patient's neck and asking them to swallow, clinicians can determine if the gland is enlarged, nodular, or tender. This technique aids in diagnosing thyroid nodules or thyroiditis. Auscultation involves listening to the sounds produced by the thyroid gland, known as thyroid bruits. These bruits are abnormal sounds caused by turbulent blood flow within the gland. The presence of thyroid bruits suggests increased vascularity within the gland, which may be indicative of conditions such as hyperthyroidism or thyroiditis. Auscultation is typically performed using a stethoscope, and the clinician carefully listens over the thyroid gland in specific locations. The bruits can vary in intensity, pitch, and location, providing valuable diagnostic clues to the underlying thyroid condition. Imaging modalities, including ultrasonography and radionuclide scanning, are invaluable tools for evaluating thyroid morphology, structure, and function. Ultrasonography utilizes high-frequency sound waves to produce detailed images of the thyroid gland. It helps identify nodules, cysts, and other structural abnormalities. Radionuclide scanning involves administering a radioactive tracer, which is taken up by the thyroid gland. This tracer emits gamma rays that can be detected by a special scanner, allowing for the assessment of thyroid function and the presence of any functional abnormalities. Laboratory investigations play a vital role in evaluating thyroid function. Thyroid function tests measure the levels of various hormones, such as thyroid-stimulating hormone, TSH, free thyroxine, T4, and triiodothyronine, T3, in the blood. These tests aid in the diagnosis and monitoring of thyroid disorders, helping to differentiate between hypothyroidism and hyperthyroidism. Additionally, they assist in assessing the effectiveness of treatment and detecting any complications. Fine needle aspiration, FNA, biopsy is a minimally invasive procedure that involves extracting cells from the thyroid gland for examination under a microscope. It is commonly used to evaluate thyroid nodules and determine their nature, whether benign or malignant. During the procedure, a thin needle is inserted into the nodule guided by either palpation or ultrasound imaging. The extracted cells are then analyzed, providing valuable information for diagnosis and treatment planning. Thyroid scintigraphy is a nuclear medicine imaging technique that assesses thyroid hormone production and uptake. It involves administering a small amount of radioactive material, usually iodine or technetium, which is specifically taken up by the thyroid gland. A special camera captures images of the gland, allowing for the assessment of thyroid function and any abnormalities in hormone production or uptake. Thyroid scintigraphy is particularly useful in cases of hyperthyroidism, goiter, and nodular diseases. Pregnancy exerts significant hormonal changes, including those related to thyroid function. Thyroid function tests play a crucial role in monitoring thyroid status during pregnancy. These tests help identify thyroid disorders associated with pregnancy, such as gestational thyroid dysfunction or postpartum thyroiditis. Accurate assessment and management of thyroid function during pregnancy are essential for both maternal and fetal health. The examination of the thyroid gland in pediatric patients requires special attention due to the unique challenges posed by their developing anatomy and physiology. Pediatric thyroid examination involves similar techniques as in adults, such as inspection, palpation, and laboratory investigations. However, the interpretation of findings must consider the age-specific variations and specific disorders affecting children, such as congenital hypothyroidism or pediatric thyroid cancer. In certain cases, when additional information is required, advanced imaging techniques such as magnetic resonance imaging, MRI, and computed tomography, CT, may be employed. MRI provides detailed images of the thyroid gland utilizing strong magnetic fields and radio waves. It aids in the assessment of thyroid anatomy, detecting abnormalities, and guiding surgical planning. CT, on the other hand, utilizes X-rays to create cross-sectional images of the gland. It is particularly useful in cases of suspected thyroid malignancies or other deep-seated abnormalities. Thyroiditis refers to the inflammation of the thyroid gland, which can manifest in various forms, such as Hashimoto's thyroiditis, subacute thyroiditis, or postpartum thyroiditis. The clinical evaluation and diagnosis of thyroiditis involve a comprehensive assessment of the patient's medical history, physical examination findings, laboratory investigations, and imaging modalities. Differentiating between the various types of thyroiditis is crucial for appropriate management and treatment. In conclusion, thyroid examination involves different methods to diagnose and treat thyroid conditions. It is important for medical professionals to understand these techniques and their interpretation for effective patient care. Keep studying and good luck in your medical journey.